So we'll start. Good evening, everyone. So today we are going to have a discussion on the role of mesothelin CAR T in carcinoma ovary. So we'll be starting with the case discussion, and then we'll be discussing some literature related to that. So, this is a 55-year-old postmenopausal multiparous lady with nil comorbids. She was diagnosed as a case of metastatic carcinoma ovary with peritoneal carcinomatosis, lung and liver mets in 2017. The biopsy done from the peritoneal mass showed the carcinoma ovary grade 3. Neoadjuvant chemotherapy with Taxol, Carbo, and bevacizumab till June 2017. Post neoadjuvant chemotherapy, the PET scan showed complete resolution of all the sites of disease, and that was followed up by the primary cytoreduction surgery in September 2007. The post-op histopathology showed serous carcinoma high grade, YPT3N1MX, and then she completed the remaining 3 cycles of adjuvant chemotherapy with Taxol, Carbo, and bevacizumab till December 2017. And after a DFI of 2 years, 6 months, the patient again had a rising CA125 levels. PET-CT done in June 2020 showed multiple mediastinal nodes and retroperitoneal nodes. Multi-gene panel was done at that point of time that showed positive for BRCA1. So in view of platinum-sensitive disease, she was rechallenged with 6 cycles of Taxol Carbo followed by olaparib maintenance till October 2023. Immediately in October 2023, she had a single site progression in the retroperitoneal node, and she underwent a retroperitoneal lymph node dissection on 18th of October 2023. The post-op histopathology showed metastatic high-grade carcinoma, and then she received 2 cycles of chemotherapy with bevacizumab, with gemcitabine and cisplatin. But immediately after 2 cycles, she had bevacizumab-related press, and she also had poor tolerance to cisplatin. Hence, the chemotherapy to gem carbo. So she completed her 6 cycles till March 2024. And then after a DFI of 5.5 months in September 2024, she developed multiple lymph nodes in the abdomen and pelvis. And then after that, she was started on palliative PEG lipodox till Jan 2020. While on PEG lipodox, her CA125 was still rising, and a PET-CT done in February 2025 did show disease progression with mediastinal liver mets, bilateral lung nodules, and the CA125 in May was 3,546. It was at this point of time that she came to our institute for further management. So the recent CT that we have done, it does show multiple abdominal nodes with para-aortic nodes, bilateral lung nodules, multiple liver mets and bony mets as well. And the recent CA125 is 4828. So we did her workup for the CAR T-cell therapy. So the IHCs that we did for her, we did the IHCs for her, and mesothelin came out to be positive for her, and the tumor cells showed 70% positivity for mesothelin. So she is a case of a relapsed recurrent metastatic carcinoma ovary with bilateral supraclavicular lung retroperitoneal para-aortic and bony mets post 4 lines of treatment, and we are planning a mesothelin CAR T-cell therapy for her. So we have already done her harvesting. Around 150 ml of stem cell apheresis has been done. We gave her bridging therapy with irinotecan 175 mg per meter square, and we re-challenged her with bevacizumab 100 mg. We gave bevacizumab with a desensitization protocol, and she tolerated it well. She did not have any side effect related to bevacizumab during the infusion. So based on this phase 2 study, we gave her the bridging therapy with bevacizumab and irinotecan. So in this study, as we can see that the PFS, the median PFS was around 6.8 months, the median OS was around 15.4 months, and with an overall response rate of around 27.6%. So discussing a bit about the mesothelin expression that we see in carcinoma ovary. So this table does show the percentages of CAR T antigens that can be seen in ovarian carcinomas. So as we can see in this table that 82% of the ovarian carcinomas does show expression for mesothelin. And apart from that, these are the other markers like B7H3 that shows around 93%, and there's around 11 to 66% of expression that can be seen by HER2 and the other markers. This table as well shows the same, the percentage of antigen expression that can be seen in carcinoma ovary. So this was the paper that came in 2020 that showed the role of mesothelin-targeted CAR T-cell therapy for solid tumors. So to understand what is this mesothelin? So basically, mesothelin is a cell surface bound glycosyl phosphatidyl anchored protein. So in this diagram, as we see that so this mesothelin, it was identified associated antigen. It was discovered over 20 years back. So this human mesothelin gene, it is located at the chromosome 16, and it contains around 1884 base pairs with an total of around 15 exon. So this human gene, mesothelin, it is shown to encode a 71 kilodalton a precursor protein containing of around 628 amino acids, and the precursor is related with the furin cleavage at the arginine 295 into two products with a 31 kilodalton MPF and a 40 kilodalton, and then this is anchored with a mesothelin protein that is bound to a cell surface. So various types of therapies have been started with the to target the mesothelin. So we have various types of therapies such as immunotoxins, antibody drug conjugates, and the recent that we have multiple CAR T cell approaches that has also been used for targeting the mesothelin. So there are some immunotoxin that is SS1P that has been tested in multiple trials for advanced cancers to target the mesothelin. We do also have some antibody drug conjugates, amatuximab and enitumab raftansin. So these are also, and the trials are ongoing. The patients are being recruited, and the results are still awaited. We also have some anti-mesothelin cancer vaccines such as CRS-207. It is a live attenuated listeria-based vaccine. And we also have another vaccine called JNJ 6404157. So these all are, the studies are all ongoing and the results are awaited. This slide shows the types of CAR T cell therapies and the generation. So like first generation CAR T cell therapy, and how with the how there is with the addition of co-stimulatory domains, and now that we have up to fourth generation T cell redirected for the universal cytokine mediated killing procedure, and which is also related with interleukin 2. So this slide shows us various generations of cell approaches that has been used for targeting the mesothelin. So this table shows us all the data that we have in all the solid tumors for mesothelin CAR T cell therapy. So in various solid malignancies such as mesotheliomas, ovarian cancers, cholangiocarcinomas. So and in this study that we are more subsequently going to discuss as well. So it showed around a PFS of around 5.6 months and an overall survival of almost 10.6 months in ovarian cancers. We do have other studies by Hassan et al. In mesotheliomas that had shown around 5.6 months of PFS benefit and 11.2 months of OS benefit. Along with that, we do have other ongoing studies as well, and the results are still awaited. So this is another study that showed the efficacy safety of novel multi-chain DAP CAR T-cell targeting mesothelin in ovarian cancers. So this was a trial that was done to evaluate the safety and efficacy of KT032. It is a mesothelin-targeted CAR T-cell therapy in patients with advanced solid tumors. So this included 8 patients. So it was a single-arm, open-label study, and it included patients with an age of 80 to 70 years with mesothelin expression of more than equal to 15%. The exclusion criteria: if the patient has received any recent chemotherapies and has any active infections. So the KT032 was manufactured from the patient's T cells, and it was infused after the conditioning. The conditioning that was used was fludarabine and cyclophosphamide. We are also going to use the same conditioning for our patient as well. So there were the 6 patients that were used, and out of them, 5 patients were ovarian cancer, and 1 patient was mesothelioma. And this was the dose of CAR T cell that was used. So, as we discussed, so 2 patients achieved a partial response while 4 had a stable disease, and 2 of the 6 evaluable patients they had partial response. So the partial response rate was of around 33.3%, and the disease control rate was 100%. The median PFS was around 5.5 months with an overall survival of 10.5 months. And talking about the adverse events, 5 out of 6 patients developed CRS, with 1 patient only experiencing grade 3 symptoms, and 83% of the patients only had nausea, with no cases having neurotoxicity. So this is another publication that came in 2023 in the Nature, that was a phase 1-2 trial showing the mesothelin targeting T cell receptor fusion cellular therapy in refractory solid tumors. So this was a open label multi-center phase 1 trial that was conducted from May 2019 to May 2022. It screened 252 patients, and there were 32 patients who subsequently received the CAR T infusion. The eligible patient had mesothelin expressing cancers. It was administered at various dose levels, and the primary objective was to evaluate safety and determine the RP2D, and the secondary objectives were to evaluate the efficacy through various metrics, including the overall response rate, progression-free survival, and the exploratory objectives included the correlating responses with Gavo cell characteristics and tumor microenvironment analysis. So this is how. So 32 patients had received the CAR T infusion at various dose levels. The recommended phase 2 dose was 1 into 10 to the power 8 cells. So we are also targeting at the same dose. We are also planning 1 into 10 to the power 8 cells per kg for our patient. So in this, as we see in the ovarian cancer, the overall response rate was around 29%, with a median PFS of 5.8 months and a median OS of 8.1 months in the ovarian cancer patients, and the overall response rate was around 20%, with the disease control rate of up to 77%, and the 6-month overall survival was 70%. And the most frequent adverse events were neutropenias and lymphopenias. So only 25% of the patients they developed grade 3 or higher cytokine release syndrome. So this graph also shows the same, that in ovarian, the median progression-free survival was around 5.8 months, with a overall survival of around 8.1 months in the ovarian cancers. And overall, the PFS was around 5.6 months, with overall survival of around 10.6 months. And as we discussed, so the most common side effect that was seen, that was neutropenia, that grade 4 around in 26 here, that we can see 81% of the patients they had neutropenia, and along with that, none of the cytokine release syndrome that was seen was only 6% of the patient had grade 4, and apart from that, it was rest other patients didn't have any major side effects. So to conclude, a mesothelin-targeted CAR T-cell therapy has shown promising potential in the treatment of ovarian carcinoma, particularly in addressing resistance to conventional therapies. So its ability to specifically target the mesothelin expressing tumor cells offers a novel approach to improving the patient outcomes. While early studies demonstrate encouraging results in terms of tumor regression and prolonged survival, so challenges such as antigen escape, tumor heterogeneity, and CAR T cell persistence remain key hurdles. So overcoming these limitations will be crucial in optimizing the efficacy of mesothelin CAR T cell therapy. So for future directions, so by enhancing the persistence, by using the combination therapies, reducing toxicities, and the targeting the tumor heterogeneity, and then expanding clinical trials and optimizing the dose regimens, will be critical approval and the broader clinical application of mesothelin CAR T cell therapy. Thank you.